Today we're going to talk about muscle spasms and muscle cramping, whether it's in your low back, in your calf, in your foot. We're going to talk about what causes that.
This is what a cramp looks like. Oh, look.
If we can prevent it, and what the treatment is for it. So let's jump right in. Hey, I'm Dr. Nate, and we are going to just talk about muscle spasms and everything that you need to know about that, how to address it. So the first studied phenomenon of why muscle spasms occur and what causes them is related to hydration and temperature. So hydration and salt imbalances, electrolyte imbalances. These first studies, which I'll put up on the screen, were done in the 1920s and 1930s on coal miners and industrial workers. And what they found is that people who were working in those settings, who were working in really high temperatures for really long hours and were hydrating with just water, they tended to have a lot more cramps. And actually some of the cramping that occurred was so severe that they had to go to the hospital. When they started to implement adding a little bit of not sugar, but salt tablets into the water, the severity, the duration, and the amount of people getting the cramps was significantly reduced. And this was done in the 1920s and 1930s. And they hypothesized that, yeah, I mean, there's this, I think the way that they put it was there's a disturbance between the amount of fluid and the electrolytes in the body. A couple more interesting points from this study was that the onset of the cramping was seen to occur with a couple different things. Number one was high temperature, so high air temperature. Two, an excessive drinking of plain water without any electrolytes. And number three, continued hard work. There was an additional factor of fatigue too, where the author and the researcher noted that men who were less physically fit tended to have more cramping at the second half of the day versus the first half of the day. Two additional authors, Chi and Kang, proposed that, and this wasn't studied in the 1920, 1930 papers, but they proposed this later, that the lack of sodium and that imbalance actually affected the nervous system itself, where it made the motor neurons more sensitive and thereby more active, and so they were easier to be able to be tripped and essentially cause an involuntary muscle spasm. So essentially a malfunction of the nerves which caused a malfunction of the muscle. That was their hypothesis. There was also a study conducted by, and this is kind of a funny name, Dill et al. You know, you've probably heard of pickle juice, but Dill, he didn't create the pickle juice. But anyways, I thought it was ironic. Haha. So Dill et al. Were studying workers at the Hoover Dam, and what they found was very similar to the prior studies of coal miners and industrial workers, where it was really hot environments. They were not making sure to keep track of their electrolyte balance, and they were very prone to fatigue, and they also ended up having a lot of cramping issues. They instituted putting salt tablets into the water again, and all of a sudden the amount of cramping reduced significantly. And again, those suffering from the cramps were experiencing dehydration, a low concentration of sodium and chloride in their bloodstream, and an increased serum protein content. What's interesting from all of these studies is that it's not just dehydration that created the environment for increased cramping to occur or muscle spasms to occur. It also was in the case of overhydration, because ultimately what matters the most based on these particular studies is the balance of electrolytes. So that's why sports drinks in Gatorade, Powerade, all of those, and some of the newer ones are so prevalent and useful, is because they can help to offset the electrolyte loss, so the sodium that's lost or the salt that is lost during exercise when you're sweating. And we also find this happen not just with the industrial studies and worker studies, but in athletes too. So those who sweat more and replenish with regular water tend to have more cramping. Those who tend to sweat less and replenish with with a salt or sodium type drink, more electrolyte balanced drink, those people tend to have less cramping. So ultimately, the combination of sweat loss, so high levels of sweat loss between 2 to 3% of body weight, and high temperatures, combine that with fatigue, and you have a pretty good recipe for increased cramping. Now, of course, this isn't going to happen to everybody. People who are less trained or less fit tend to have more cramping as well. So this goes to say that sweat loss alone or an imbalance of those electrolytes can't explain all of the variability in the occurrence of cramping. And this brings us to our second proposed mechanism of muscle cramping. Neuromuscular control. So altered neuromuscular control in back spasms, in calf cramps, in foot cramps. We're going to talk about that now. So you've probably seen on any sports field that if somebody cramps up, immediately they start to stretch the affected muscle. So like somebody has a calf cramp or a foot cramp, immediately the trainer comes over and stretches that out. If you have a back spasm, your first instinct is to go ahead and stretch it out, right? You try to move around in different ways, just try to loosen it up because that's what stretching is supposed to do. Well, this is going to be really interesting and maybe a little shocking for you. The researcher that looked at this, it was actually just one subject, and they induced a muscle cramp, and then they stretched that person, and they said, oh yeah, it helps. And now we have a bunch of people, everyone believes that just stretching out a muscle cramp is the best way to do it. Not necessarily. But we're going to get to that a little later. I got off track. So the altered neuromuscular control. So the idea is that the brain itself controls all output, right? So you have input that comes into the brain from the peripheral tissues, and then your brain makes decisions of what to do with that information. So the idea is that if there is high thermal stress, if there is fatigue, that our brain will decide to, okay, we're going to cause a cramp down in that area for whatever reason. We don't know particularly why. I have some speculative reasons why I think that might happen that I'll share at the end of this video. But the idea is that, again, that there is an abnormality of alpha motor neuron control at the spinal level. And basically, for all you who aren't familiar with what an alpha motor neuron is, basically controls muscle contraction. The problem with this altered neuromuscular control model is that it's really unpredictable. They can't really they can't make it completely reliable even when testing it in the lab. A lot of the studies have been done on animals. There have only been really small studies done in humans. And while there is increased excitability of some of the nerves, which would cause more muscle and easier muscle contraction and spasm, again, it's not easily reproducible. So in all of these, it's in a lab setting too, so it's hard to measure that out when somebody's on the field to see, like, you can't like set it up where somebody's immediately having a cramp. You can't like do the intervention right on the field. Well, at least I don't know how they would do that. So for me, I think that based on this particular paper, which was more of a review, I think that the thought of the dehydration or overhydration, the electrolyte imbalance, that makes a lot more sense to me based on what I have seen, based on what I read here, and kind of follows along with some of the larger studies, especially, the ones here were more observational as well that we looked at. And it was pretty clear that you add in more salt and all of a sudden there's a decrease in the amount of cramping that happens. So ultimately, the prevention strategy that is most useful, that was talked about most in this paper, was making sure that if you are sweating a lot, that you're replenishing with not just plain water, but with a electrolyte balanced drink. So, something with sodium in it, right? So that's going to be the most potent way to reduce the severity and the duration of the muscle cramping that you might be experiencing. And so don't just drink plain water. Don't do that, because you probably will cramp more. Some other strategies, a lot of people have a bunch of different ideas of what to do, like drink pickle juice or whatever. And pickle juice, there have been some studies that actually looked at that, and it does have a pretty high sodium concentration, so it likely is a decent strategy. It doesn't taste great, but it can help. Or you could just drink something that tastes good that also has sodium. So it doesn't really make a difference as long as you have something that is bringing in more electrolytes, because remember, you're losing salt when you're sweating. There are other things too, but I'm not going to go into those. The last thing I wanted to say is they didn't really touch on this, but it was pretty clear that we experience more cramping when we're fatigued. So regardless of whether it's hot or cold, there is cramping that occurs when we are more fatigued. So, and additionally, in some of those studies, it said that the people who are more fit tended to have less cramping. Now, being more fit, being stronger, and actually training to fatigue, where you are effectively causing a maximal contraction, in my mind, this is just my hypothesis, that if you cause that maximal contraction and you do that enough and you practice that, you'll likely have less cramping. Now again, this is just my opinion. It makes sense to me that if you train at a high level and you have to, you're doing things in your daily life or your work that require high levels of energy, or you are getting fatigued, that you'll be less likely to have that issue. Trained individuals tend to just have less issues across the board versus untrained. I mean, think of the weekend warrior who goes out to play basketball and then tears their hamstring because they only sprint once every weekend or every 2 weekends. They don't train at all. Of course, they're going to have a higher risk of injury. They're going to have a higher risk of cramping. They're going to have a higher risk of basically everything. So the best thing that you can do to reduce your risk of cramping is, of course, number one, like the research was stating, to make sure your electrolytes are balanced, but also that if you are going to be doing something that is highly fatiguing, train your body to be able to tolerate that. So you will have to likely do harder exercise. You will likely have to push your muscles to a point where they are getting maximally fatigued or close to it. So that's just my 2 cents on all of this. Thanks for watching this video. Please like it and also subscribe to my channel if you like videos like this that go deep into the weeds. I could have gone even further, but it would have been a 55-minute video. So thanks again for watching. Please leave a comment below if you were surprised by this information, if it makes sense to you, and what are some of the strategies that you have used to reduce muscle cramping. Thanks again for watching. Stay strong, stay resilient, and keep getting after it.